Hi friends, artificial intelligence is the buzzword of modern era. Everybody, right from students to professionals, are very much concerned, anxious and inquisitive about how AI is going to change the modern world. So here we have got an expert to discuss about the medical science manifestations and implications of AI. And the expert we have got today is none other than Dr. Shibu Vijayan, who is a leading public health expert who is also well versed in technology in the public health sector. Dr. Shibu Vijayan is an alumnus of the 1988 MBBS batch of Trivandrum Medical College. He then did his Master of Public Health from the prestigious Sri Chitra Tirunal Institute of Medical Science and Technology. He has worked in several countries as a WHO consultant of tuberculosis. He was in charge of the tuberculosis control program of WHO of India. He later worked as field epidemiologist in Ethiopia and several African countries. He was also a consultant of PATH, and currently he is working as the medical director of Qure.ai, which is a startup organization which is focusing on artificial intelligence. Dr. Shibu has contributed a lot by publishing research on the technological aspects in the field of diabetes, in the field of tuberculosis control, and so many other areas. So welcome, sir, to our discussion today. My next question is, sir, nowadays there is a focus on competency-based medical education. The intern medical graduate is expected to graduate after having acquired a set of competencies, which include a lot of skills related to diagnosis, patient care, communication, doing procedures, etc. So with AI coming to medical sector, do the doctors have to be trained in a new set of skills, technological skills? And what sort of training may be necessary to be imparted to these doctors?
As of now, because see, the medical knowledge is so vast, like starting from the basic understanding of the human anatomy, physiology, pathology, and the disease progression, and then coming to the actual diseases and how it pans out. It's a so when a patient is being seen by a doctor, so a lot of actually neural networks flow in their mind to make a logical conclusion derived from investigations from the patient signs and symptoms. How do they kind of what they elicit from the patient, and then arrive at a conclusion, which is with options. So which is the natural process. So on the other hand, what AI does is that to help the doctors in synthesizing this in a way which is very easy. So we don't need to grapple around 100 reports. So all the reports will be synthesized and summarized in a way so that we can arrive at a decision. So probably a differential diagnosis list will be available. Then the doctor need to apply his mind, seeing the patient, and then come. So coming back to your question about specifically about the skill set. As of now, these are all very simple as a Google thing. So if you look at all the medical Gemini, or even the Pad one from Microsoft, is also designed in a way that it has, because that's how the technology. So every technology, how did we crack the mobile? So we all know that mobile is something like a needed assistance for now, right? So it started from very basic analog stuff to now much more actually kind of enhanced stuff. So every user interface is being built in a way that users can easily not deviate from an existing behavior. It is included in the existing behavior of like and asking a question and getting a summary. So what skill required is we also need to understand what question need to be asked. So your response from a computer, even if it is simulating like a human being also need to ask the right question to get the right answer, right? So your question framing skill is something which you need to. It's not like a Google saying, okay, Google somebody's name, or Google some places thing. We can even conversation. So now the new the long language models, which is again massive millions and trillions of text has been input in developing that computer models, wherein you can even ask doctor, I am having, like for example, if I am asking, it can even learn Dr. Arun's patterns of prescription, how Arun arrived at a clinical decision when you are interacting with the patient, and your prescription patterns. And after some point in time, it also kind of behave something similar to Dr. Arun. So that customization is possible. So all this so they call it, as the engineers call it as foundation model, which have millions of data. Then you customize it accordingly. So there is a platform already made. It's pretty much like a vehicle, like a petrol vehicle has a system. Then you pay for other, maybe for more power, more comfort within the car. So something similar to that thing. So you have a basic machine which actually gives you, which captures all the purpose of the information, and then you on the top of it you customize it to that level. So almost all the applications are designed like that, from a foundation to a customized way. So in that sense, there is no rocket science required. There is no additional skills, which is, I'm not anticipating a huge change in existing behavior. It will be within the existing set of skills. A medical student or a doctor can actually kind of behave better. So I would say a digitally enabled AI-powered doctor versus a basic doctor will have huge difference in approaching the patient, huge difference in delivering the quality services, huge difference in knowledge acquisition also. And they have a quality of life also on the side, because if you're seeing in a cluttered outpatient department, if you're seeing thousands of patients and spending less than a minute, I don't think that we are doing justice to that community who are actually coming with a lot of expectation to actually get a quality services. That will get decongested to a 30-minute conversation with a 30 meaningful patient to be seen by a consultant of that status. So in that way, they also get a lot of their own individual living space in the world of digitally assisted AI-powered assistance.
That's really comforting, sir.